The purpose of this podcast is to educate and to inform. This is not a substitute for professional medical care and is not intended for use in the diagnosis or treatment of individual conditions. Guests on this podcast express their own opinions, experience, and conclusions. The mention of any product, service, organization, activity, or therapy should not be construed as an ASCO endorsement.
Welcome to the ASCO in Action podcast, brought to you by the ASCO Podcast Network, a collection of 9 programs covering a range of educational and scientific content and offering enriching insights into the world of cancer care. You can find all of the shows, including this one, at podcast.asco.org. The ASCO in Action podcast is ASCO's podcast series that explores the policy and practice issues that impact oncologists, the entire cancer care delivery team, and the individuals we care for, people with cancer. My name is Clifford Hudis, and I'm the CEO of ASCO, as well as the host of the ASCO in Action podcast series. For this podcast, I want to provide a quick update on an important announcement that just came from the Centers for Medicare and Medicaid Services, which we, of course, refer to as CMS. In early November, the agency released its final rule for the 2020 Medicare Physician Fee Schedule, commonly referred to as the Physician Fee Schedule. And with that came other changes to Medicare Part B reimbursement policies, including proposed updates to the Quality Payment Program. Now, just to review, the Physician Fee Schedule is a complete listing of fees that Medicare uses to pay doctors or other providers and suppliers. It is also a comprehensive listing of maximum fees, and this list is updated each year and then used to reimburse providers on a fee-for-service basis. At ASCO, we always review this rule closely. Our goal is to assess its likely impact on our members and, most importantly, their patients. The top takeaway from the rule is that CMS estimates a 0% overall impact for the hematology oncology and radiation oncology specialties in 2020. Though it's important to note that the actual impact on individual physician practices will depend on the mix of services the practice provides, and practices in certain states may see a change due to the elimination of the 1.0 threshold previously applied to the geographic practice cost indices. CMS also finalized provisions to align evaluation and management, or E&M, coding with changes laid out by the CPT editorial panel for office and outpatient E&M visits. This is a welcomed update that comes after ASCO and other stakeholders expressed concerns that earlier CMS proposals to consolidate E&M codes might have diminished the resources available to care for Medicare beneficiaries with cancer. We appreciate the fact that CMS listened to our perspective and revised its plans to better serve patients with cancer. The Physician Fee Schedule rule also finalizes updates made to the Quality Payment Program for 2020 and beyond. There was a key update made to the Merit-Based Incentive Payment System, or MIPS. Remember, that's one of the Quality Payment Program's 2 tracks. In this case, all 4 MIPS performance categories will remain at their 2019 weights in 2020, but the performance threshold, which is the minimum total MIPS score that a practice needs to avoid a negative payment adjustment, will increase to 45 points in 2020, and that's up from 30 points in 2019. CMS also finalized its plan to establish MIPS value pathways, or MVPs, beginning in 2021. CMS has described these MIPS value pathways, or MVPs, as a way to reduce the burden of participating in MIPS and for CMS to at the same time collect more meaningful performance data. The MVP framework would connect activities and measures from the 4 MIPS performance categories that are relevant to a patient population, a medical specialty, or a specific medical condition, such as cancer. For years, ASCO has encouraged the use of high-quality oncology clinical pathways to help ensure patient access to the highest quality, highest value cancer care, and we are hopeful that this provision in the CMS final rule will represent a move in the right direction. We have also appreciated the recent efforts CMS has made to reduce administrative burden for providers. MVPs, if implemented appropriately, may help improve the quality and accessibility of cancer care, and we will continue to work closely with CMS as it implements this new provision. I hope this summary of updates to the Physician Fee Schedule for 2020 was helpful to you, our listeners. Our ultimate goal is always to ensure that oncologists can provide the right treatment at the right time, and we aim to help CMS implement policies that advance this goal. To that end, we will submit detailed comments on the final rule during the open comment period. Our goal is to ensure that CMS understands the needs of the oncology community and the full impact that their rules are likely to have. If you would like more information on Medicare physician reimbursement in 2020, please visit ASCO in Action at our website. That's asco.org/ASCO Action, and I'll note that ASCO Action is written as just one word. Until next time, thank you for listening to this ASCO in Action podcast. If you enjoyed what you heard today, don't forget to give us a rating or review on Apple Podcasts or wherever you listen. And while you're there, be sure to subscribe so you never miss an episode. The ASCO in Action podcast is just one of ASCO's many podcasts. You can find all of the shows at podcast.asco.org.
If you like what you hear from the ASCO podcast, please let us know. Take our listener survey and help shape the future of the ASCO Podcast Network. Visit podcast.asco.org and click on the survey link. Once again, that's podcast.asco.org. The survey will just take a few minutes to complete and will help us get to know you better. Thank you so much for listening.